Donc, on y a là, nous allons aller avec Dr. Patrick Lolo, qui lui-même qui est avec nous, qui est un dentiste qui va aller avec nous pour expliquer nous qui ça veut dire pour nous assurer que nous en bonne santé. Merci, Dr. Patrick.
Bonjour tout le monde, je parle un petit créole tout petit, mais créole ne pas trop bien, so je parle un petit anglais aussi. So, nom c'est Patrick Lolo, moi c'est petit frère Deborah Lolo, nous connaissons tout le monde comme Dr. Deborah Lolo, le président de HAPA. So, merci pour belle fête ça vous fait pour la communauté et merci à tout HAPA pour volunteer time nous, pour nous manger dans la communauté à son bel event. Mais même mon nom c'est Dr. Patrick Sébastien Lolo, moi je suis dentiste de Timoun, je suis dentiste pédiatrique. So, si nous avons des gens, nous avons des informations, nous allons ouvrir un office, nous allons si nous venir. Si nous voulons venir petits, nous venons, ça fait une belle bagaille. So, ça me voulait parler aujourd'hui, c'est de dans nous. Tout le monde la communauté haïtienne, comme si nous avons un problème cœur, nous avons un problème cholestérol, nous avons un problème sucre, mais pas aucun monde qui peut parler de dans la communauté. Nous. So, fact sort for research on study that I'm about to say publish within the next year or so. And research ça me fait, c'est un research dans la communauté haïtienne spécifiquement. Je voulais connaître qui genre knowledge haïtien est le topic dental, ok? So, nous connaissons Florida, South Miami, c'est le deuxième plus gros côté qui gagne haïtien en Amérique après New York. New York gen study par l'autre bois, gen study en Haïti, mais pas jamais gon study dans South Florida, le monde qui dans South Florida. So projet travail là-dedans, son projet, nous devons regarder qui genre knowledge nous dans la communauté haïtienne. So, ça me dit ouais, j'aime faire projet nous dans la communauté nous allons demander un bon monde qui ça, combien de fois vous supposez bosser bouchou, qui leur supposé bosser bouchou, qui sont connaît de dental, qui leur supposé mener petit tout à dentiste, combien de fois on doit aller à dentiste, combien de temps on doit bosser bouchou, qui qualité de manger qui va le faire dans plus dispositif de carrière. So toute information ça nous demande. So nous dans toute communauté haïtienne dans Little Haiti, nous dans Marguerite. Nous sommes allés dans Doral, il y a un peu haïtien l'autre bois, et Miramar et Hallandale. So, ça nous de tout le monde qui est dans South Florida, communauté haïtienne et lui-même qui connaît, that knows the least about dental health. Nous ne connaissons rien de dental education. So, quand j'ai commencé le projet, ça, that was going to be my result. Parce que, dans Haïti, je ne connais que les gens qui sont dans dentiste. Moi, je vis en Haïti pour 10 ans, je suis ici à 11 ans. Moi, je ne connais aucun monde qui est dans dentiste. Moi, je connais un dentiste, mais je ne sais pas songer qui l'homme, je connais un monde qui est dans dentiste regularly. Okay? So I already kind of knew that the community was not very knowledgeable in dental. So what my results were is that our community, truthfully, has the least knowledge in dental. So what I wanted to do is éduquer la communauté un petit peu de dental. Okay? So, premier, ça me devait parler de c'est qui qualité de manger qui cause carrière. Tout le monde connaît c'est, surette, by douce, by ça, but that's really not the truth. It's not the only thing. Toute qualité de manger qui nous manger qui gain carbohydrates in it, all of those foods are going to turn into sugar. So it's kind of like, let's say if you're eating bread, you're eating pasta, you're eating banane pesée là, tout bagay ça yo manger yo pral bactéries en bouche pral process li, yo pral tourner ça onto an acid, you call it. Okay? So meaning the bacteria is going to take the food, is going to process it, and it's going to turn it into acid. And that's the same thing that happens with sugar. Donc nous toujours dit nous pas manger surette, pas manger surette. Oui, that's the truth, but nous-mêmes tous nous devons contrôler ça n'a manger et combien de fois n'a manger. Pas dire nous pas manger nous voulons, but the biggest issue is how often you're eating. Soit manger 2-3 fois par jour, that's okay. The reason why I say that's okay because you allow your mouth to recuperate from the acid attack that's going on. So let me back up. So let's say you're eating some bread, right? As you eat the bread, an hour to 2 hours after you eat the bread, the bacteria in your mouth is processing the bread and it's turning it into acid in your mouth. And that acid is actually breaking down your teeth, okay? So let's say you eat and you think, oh my gosh, let me run and go brush my teeth right away. You're actually doing yourself a disservice. You're introducing even more acid in your mouth. So the real thing that you want to do after you eat is to drink water to wash out your mouth so that your mouth doesn't have an acid attack, that we like to call it. So the most important thing about preventing cavities is how often we're eating and to not allow your mouth to have an acid attack. So you wake up, you eat, right? You want to drink some water after. Allow a couple minutes to pass, then you brush your teeth. So you don't want to eat and brush your teeth right away. Does that make sense, everyone? All right. The next thing I want to talk about is periodontal disease. Okay, that's another thing that is very common in our community. What is periodontal disease? Periodontal disease, it's a disease of your gum. So, gencive. Okay? Son bagay qui vraiment populaire dans la communauté nous parce que nous pas éduqués de topic ça. So, how do we prevent periodontal disease or gum disease? It's very easy. All you have to do is floss. But most of us, we don't floss. We don't like to floss. We think that all we have to do is brush our teeth in the morning, brush our teeth at night, and that's it. Well, that's great. You're going to keep your teeth clean, but you're not really protecting your gums. So that's why we recommend that you floss at least once a day, starting from the age 12 and up. For your kids that are under the age of 12 that still have baby teeth, we still encourage them to floss, but we know it's much more difficult to stay on top of them. So if you can do it like 3-4 times a week for them, that would be great. But for adults, we recommend that you floss every day, at least once a day. So just to kind of recap everything I spoke about, the number one factor in causing cavities is not really eating candies, it's how often we're eating. Okay, so if you're somebody that's eating 10 times a day, chances are you're more likely to experience cavities. So let's jump back to kids, right? Kids tend to snack a lot. So we think it's the candy that's really causing the cavities, but in reality, the kids are eating throughout the day. Kind of like my nephew over here. He eats in the morning, he eats at 10, he eats at 11, at 12, at 1, at 5. So it's not really the candy, it's the fact that he's eating throughout the day and you're not letting your mouth time to recover. So you need that time to allow your mouth to recover. Now, why in the past cavities were not that common in the world? Because we didn't eat that much. L'enlever ou manger, or you have to find somewhere to get your food and then maybe you eat once or twice a day. So cavities was not very common in the past. But now it's the number one chronic disease in the world, believe it or not. Pagin monkey really think about teeth like that, but think about this for a second. All of the disease I was hearing you guys talk about, all of them start with your mouth. All of the disease that they were talking about today, you can avoid most of them. Heart disease, high cholesterol, high blood pressure, the plaque the plaque that you develop in your heart. Guess where those bacteria come from? They're the exact same bacteria that's in your mouth. So meaning, if you control your diet and you control what you're eating and you limit the amount of time you're eating, and obviously you brush your teeth in the morning for 2 minutes, you brush your teeth at night for 2 minutes, and you floss and you make sure you drink plenty of water, those are what you need to do to protect your oral cavity from cavities and for periodontal disease. And the last thing I'm going to leave you guys with, I've been working at Nicholas Children, aka Miami Children's, for the past 8 years, and now I'm transitioning to private practicing. So I am opening up my own, I'm in the process of opening up my own office. It's going to be in Hollandale Beach. The projected opening date is going to be early July. My mom has some flyers here. If you guys have any kids, anyone that you'd like to bring, I would gladly accept. We accept all insurances, no insurances, and you're going to get a very highly educated Haitian American dentist who's very, very passionate about our community. My goals is to, the same way Daniela was saying earlier, is to uplift our community, to set an example for especially young black kids and young black males, because we don't get to see many people like me. I know myself, when I was growing up, I never see someone that looked like me that's doing what I do. So my goal is to expose myself as much as possible to our community so we can influence these kids that they can do more than just become athletes or rappers or whatever it is, that they could pursue a dream and become a doctor. With that being said, do you guys have any questions for me? Yes.
I have a question too.
Go,
Okay,
go.
so my question is, you were saying, about what we eat. Can you tell us what your diet is like?
Yeah, so she asked about what I eat and what the diet should be like. Probably the wrong person to ask. I like to eat everything. but in reality, I floss, of course. I don't like sweets. I've never been a person that likes sweets that much, and you can ask my mom. I don't like cake. I don't like candies. I don't like bonbon. I don't like those things. I've just never liked them. But my weakness is ice cream. I love ice cream. But I eat everything else. But I just control my eating. I typically eat twice a day. I like to fast in the morning. I do intermittent fasting. And I usually like to eat around 11, 12. And once I eat around there, I'll drink some water. And then I'll usually have dinner. And then I'll probably snack maybe once a day. But I tend to eat pretty healthy. I like to eat my greens. But the main thing is I try to stay away from sweets as much as possible.
Oil pulling, how do you feel about oil pulling? I'm so sorry. Oil pulling, have you heard about
Oil pull, I've never.
Yeah, coconut oil. Yes, you eat longer.
Switch your mouth oil.
So yes, I have, yes.
On a seulement 2 questions encore, ok? On a 3 questions. C'est Evans, ok? 2. On va commencer avec Evans.
Okay. Yes, so that actually helps protect your mouth from certain bacteria. So it is a good thing. Now, there's not much research about it, so I can't promote it, but I have heard about it, that it helps protect against the oral bacteria.
Docteur Lolo, comme nous sommes dentistes pédiatres, nous avons un petit monde là qui besoin poser une question, ok? La première question avant tout comme mieux.
Have you ever dealt with disgusting teeth?
Well, believe it or not, I think I've probably dealt with the worst of the worst, because I work in a hospital, so I mainly treat a lot of special needs kids, a lot of kids that are 2, 3 years old with a mouth full of cavities, believe it or not, and we put them to sleep usually, and I have to take care of and treat the whole mouth. So yes, I've dealt with the worst of the worst that you could ever think of, like kids with 20 cavities, 30 cavities, yes, so that's why it's very important. And we gotta stay away from those sweets, drink lots of water, and brush twice a day for 2 minutes. All right?
Heard that now.
Question par moi. Il y a un petit monde qui a à peine 22 ans, il a développé cancer du sang. Dans la connaissance que c'est dans la famille chronique ou bien cause qui fait
Cancer du sang, I'm going to say it's a topic Pam, but I think maybe she can answer that for you. Any other dental questions? Really doesn't matter, believe it or not. The research have shown if you floss once a day, your chances of periodontal disease is 90% lower than everybody else. So it doesn't matter when you're doing it, as long as you're flossing at least once a day. Now, I like to floss at night because I don't like to feel food in my mouth, but if we can get at least, you guys could do it at least one time throughout the day. What I usually recommend is all of us like to sit down and watch TV, right? At least at one point throughout the day. So why don't you just put some flossers right by where you sit, so while you're watching TV, you just go ahead and take care of it so that you don't have to worry about it right before you go to sleep. So that's usually what I tell most people.
And then you should tell them.
Hey, good job guys, good job Hapa. Alors, question que je pour Dr. Lolo, c'est que floss là, qui méthode qui the best way of doing it? Est-ce que c'est the pick que vous utilisez ou bien avec the water floss que vous dites qui est très bon? So which one is better?
So great question. So the water floss is really not the best method at all. It's kind of like it's more so like an advertisement scheme to companies use to make money. Now, if you want to use it as an extra step, it's great. But what happened is a lot of time when we eat, the plaque gets stuck to our teeth. And when you use that water floss, it's not gonna get the plaque off. So you actually need to go ahead with the floss. You can use, I sometimes use the little flosser sticks with the little string in there. And then you just have to make sure you're doing the right method. You have to go down. You don't just put it in between and take it out. You go down, you rub it against one tooth, and then you rub it against the other tooth, and then you come out. So you don't just go pop, pop. You go down and rub, and then take it out. Does that make sense? All right, bet.
Yes. One last question. Et son bagay que vous réalisez que il prend temps pour nous voir si il y a un problème ça. Saliva stones for mouth care. Saliva. By the time qu'on réalise au gen ti grain ça qui colon côté sans dans ti grain jury couleur jaune ou bien marron qui senti dans bouche ça ne pas le dire. Okay? It takes time. Comment on moun ka fait pour ka prévenir problème si vous senti ça qui boit tonsil qui boit tonsil comme on dit
So problème dental là usually un bon moun pa remet al kay dentiste parce que they wait too long, right? So by the time they go, there's a lot of problems wrong with their teeth. So the best way to prevent any of that, and I like to tell everybody, is to go to the dentist at least once a year. If you start that at a young age, you're gonna have such a great experience that you're never gonna have to deal with issues. So problème qui gagne la communauté haïtienne, et nous pas mener petit nous kay dentiste les jeunes. And that's why I'm here, and hopefully all of you guys can bring your kids. The earlier you bring your kids, right, they make a relationship with us. They're gonna live longer, she's right. You're gonna spend less money on their dental health, and they're gonna enjoy the dentist. But the problem is we're backwards, right? It's because when we have a problem with our teeth, it doesn't hurt right away. So we're like, oh, we could just chill and wait. And then when it starts to hurt, that's when you want to go. Well, when it starts to hurt, it's too late. Usually they got to take the tooth out or you got to do a root canal. So the issue is you just have to get in early. Okay? Now, as far as specifically tonsil stones, warm salt water rinse will get rid of them.
Oh my God, Dr. Lolo. Woo! We could be here all day today. There's more questions coming. Actually, we're gonna give someone a chance to say.
Like changes, right? It's kind of like, you know, having a push start car versus having a key. Which one is a little bit better? You know, they're both useful, but the push start is a little bit more modern. Well, let's translate that into dentistry. If you're brushing your teeth properly with a regular toothbrush, you're fine, right? But the electric toothbrush has been shown to remove plaque more efficiently. Sorry, I'm thinking Creole and speaking English. More efficiently, okay? So what does that mean? For our young kids that are not great at brushing their teeth, right? They like to brush real fast. It might be better for you to get them an electric toothbrush because that toothbrush is gonna clean better than the regular toothbrush. But for us adults, if you know how to properly brush and you're doing the right techniques, which is angling your toothbrush at a 45-degree angle. I'm not sure if everybody knows that. So you don't just put the toothbrush straight at your teeth. You aim, let's say if you're brushing the top, you aim it up at a 45-degree angle and you go in small circles. And then when you're brushing the bottom, you aim it down at a 45-degree angle and you go in circles, okay? So if you're doing those techniques, the electric and the regular toothbrush is the same. But if you're not doing the proper technique, the electric toothbrush is better, okay?
Good afternoon, everyone. How's everybody doing? Good afternoon. All right, out of the 5 senses, which sense is the most important? Who can tell me which of the sense is the most important? Okay. Smile. Smell. How many people think they can live without their nose? Raise your hand if you think you can live without your nose. Who can? Who can?
Thank you.
You can. All right. Who else can tell me, if you had to guess, which of the 5 senses is the most important? Your eyes. Your eyes are the beacon that guides you to where you need to go. Without sight, it is almost impossible to continue life, unless you were born blind. That's a different scenario. If you were born blind, you know what to do. If you weren't born blind, it's going to be a little difficult for you, okay? For the adults, I'm going to start off with the adults. Surtout pour nous mêmes haïtiens, en plus nous checker vision nous dans l'âge de 40, right? That's when you can't read anymore. You go, you say, listen, I woke up one morning, I can't read. Did it start at 40? No, it did not start at 40. It could be anything. All you know, you can't see. So you come in and you telling the doctor, I can't see. Doctor, I can't see. I need glasses. What if it's cataract? What if it's glaucoma? What if it's diabetes? What do we do for you? What do we do for you at this point? You want glasses and we're telling you no, it's not a glasses problem. What do we do? Unfortunately, the eye isn't something we run into surgery for. We don't run into surgery for eyes. You would have to lose probably 80 to 90% of your vision before someone is willing to do surgery on you. Once it's gone, it will not come back. If you have 50% of your vision, no one's gonna operate. You have to be at least 80% totally gone before someone's willing to say, we're gonna try this procedure. It may or may not work. And you sign a release. That's how that works, okay? So for the adults, we want you guys to start coming in before 40. You come in at 30. If you have high blood pressure, you have diabetes, you have cholesterol, you're coming in at 30. We're screening you. We're seeing if you have diabetic retinopathy. How many people here know what diabetic retinopathy is? Anyone that correct. If you have diabetes, diabetes affects every part of your body. Every part, every part. If the body part has a blood vessel, diabetes can attack it, okay? When do you know that diabetes has attacked your eyes? When you can't see. Doc, I can't see, give me glasses. It's diabetes. We don't fix diabetes, that's not what I do. I give glasses. I want to give you glasses. I'll give you 1 million prescriptions. I want to do that for you, but I can't. Diabetes is one of probably the #1 causes people don't see anymore. They don't see because it's too late. So you're not coming at 40, you're coming in at 30. You're coming in earlier so we can do preventative care. The second cause is usually cataracts. Cataracts is very treatable. I understand as Haitians, we're very scared of someone going into our eyes and doing surgery, but it is a very preventable cause of blindness. Once you get it checked and you understand what it is and how they cure it, you are on your pathway to success. If you wait too long, you will lose your vision. Cataract is treatable. The last one is glaucoma. Glaucoma is a silent one. It's just like cancer. It does not hurt. You don't wake up and say, I'm blind today. Cancer is a disease of years, of decades, 10, 15 years. You have this disease eating away at your eyes and you're coming in and you're saying, Doc, I need glasses. What am I gonna do for you? There's nothing I can do. So you're coming in earlier. You're getting it checked out. We're checking your pressure. We're asking the questions. Is it in the family? Does a parent have it? Do you know anyone that, could possibly in your family may have it? Did you get hurt? Sometimes, right? We get hurt. We hit our eyes. Now we're 40 years old. But you're coming in and then you tell the doctor, this eye has always been my bad eye. I don't know, I think I was born that way. It was the trauma that you had when you were 10 years old, when you were 15 years old. Now it's coming back as glaucoma. So these are the things that we need to take care of before you're 40. We can't help you after it's already done the damage. So for the adults, cataracts, glaucoma, diabetic retinopathy, these are the things that we need to be aware of because once the damage is done, it's irreversible. We cannot reverse it, okay? For the kids, a lot of kids, it's very hard to determine if they're able to see. A lot of kids don't get the primary screening that they need. A lot of kids, it's the teacher sending the child back home to the parents. Your child cannot see. I have to move your child up. So for kids, it's a little bit more difficult because a child doesn't understand what they're supposed to see. I can tell my kid, I see that, and my kid say, yes, I see that. But I'm not sure if my kid see it the way he's supposed to see it, the way she's supposed to see it. So you need to do vision screening for the kids. A lot of kids have learning disabilities. A lot of kids are labeled dyslexic, and they're not. They cannot see the letters. They cannot read because they can't see. It's not a learning disability. It is not dyslexia. It is the fact that they can't see the letters. They're horrible in math. They don't like to read. Why? They can't see. Get the kids screened earlier. A lot of the behavioral problems we have in school is because there's nothing to focus them. Their eyes can't see what's going on, so they are not interested. They're not participating because they're not seeing. Also, too, for the kids, when you have a child and their eye is turning to the left, the eye is turning to the right, that is not normal. That is not normal. If you let it go too long, it will be bad for that child. It is not normal. If you see your child's eye is turning, it's not able to fixate, to follow. If you have a toy and you wave it in front of the child is supposed to track. It's called tracking, right? If you can't track it, that means you didn't see it. And if you didn't see it, something's going on here. If you hear a plane flying by, the first thing you do is you look up and you start following. Everybody does it. It is an instinct that we do. So it is abnormal if you cannot track. You cannot read, you cannot follow, you can't pay attention. So the kids do need to be screened at an early age so that we can prevent these problems. We can prevent them being labeled as, problematic children, as kids that have learning disabilities. This will save you and your child a lot of problems in the future. And then finally, one of the other things I wanted to talk about was just eye health in general. The eye is something that is very important. It is an organ. It is a part of our body that is irreplaceable, and it is very hard to regain vision once vision is gone, if we can regain vision once it's gone. So you guys, all of us need to do our parts in taking care of our eyes as well as the eyes of our loved ones. If you have a family member and that member is blind, that will affect you as the family member's relative. You have to stop what you're doing. Take them to the grocery store. Take them to their appointments. You have to be with them because they can't see. So the quality of life for both you and that member is greatly affected. So it's not you taking care of your eyes, but your loved ones as well. If you notice they're squinting, they're not seeing well, they're complaining, have them go check their eyes. Once you've lost sight, your quality of life has decreased tremendously, tremendously. And we may not always be able to get it back. That is the most important thing you have to keep in mind. If we do not regain your vision, what do? Can you go to work? No. Can you feed yourself? You can't even feed yourself. You can't see your food. You can't clothe yourself. Life can stop for you just by your eyes. So hopefully today we had a little station over there. A lot of people came by. I had a big 40 sign, and that was to grab people's attentions to let them know that 40 is not when we start vision care. Vision care needs to start way in advance, especially now with the technologies, the computers, tablets, the phones. Go get your eyes checked out. Make sure you're in good standing so that if there's anything we can do to prevent any permanent damage, we're able to help you out. I don't know if anyone has any questions.
I have a question.
Yes.
How effective are the medication that
The question was, how effective are the medication to treat glaucoma? Before I ended up where I'm practicing currently, I was working in Oakland Park, and my patient base was Haitian. Because when I went to school, that's what I wanted to do. I wanted to get the word out. Glaucoma is a very notorious disease. There is no pain. You will never wake up and say, my eye hurt, it's glaucoma today. Never, never. And so I thought that if I could give back to the community, a lot of people would understand how serious it is. The drops, the medication are very effective, but you gotta put it in your eye. It doesn't work in the bottle. Put it in your eye. I have several patients that are in stage glaucoma. I'm talking about 40-year-old able-bodied men, you know, that could still probably have 3-4 kids in stage glaucoma because they didn't put the drop in their eye. It works, people, it works. You put it in your eye, it decreases the pressure, and you can possibly have another 30 years with vision. It works.
So I know there's laser, right? So between the laser and the actual
So vision, like I said, is a very complicated, very complex sense. Surgery is almost always last on the list, okay? If you go in there and you say, hey doc, I'm not seeing well, let's do surgery. Doc, my eyes are tearing, let's do laser. Oh, this is not the person for you. It is the last resort. Drops work great. Anyone that's willing to go in cut is not after your best interest. Now, when do we do the laser procedure for glaucoma? That's in stage. That means we've tried every drop. We've thrown everything at you and it's not working. That's when we do that procedure. It is the last resort. Okay, so the question was, how long does the person stay on the glaucoma drops? So just to kind of educate you guys on what glaucoma is pressure in the eye. The eye needs pressure. As long as you're breathing, you will create pressure, right? So you already know the answer. So if you're breathing, your eye's creating pressure, you're gonna need the drop. Your eye cannot not have pressure. That is not an option. It has to have pressure. Now what we do with the drops is we control the amount of pressure that's being made, okay? So again, a lot of people when they hear glaucoma, they are saying, well, I can't be on the drops forever. But what do you want to do? You want to go blind? Put the drops in your eye. You eat every day, you poop every day, you drink water every day. Put the drops in your eye. Why not? It's that simple. They work, but not in the bottle. In your eyeballs, they work. Great. Use your drops, okay? It is very hard to find assistance, to find someone to help you, to give up on their lifestyle, to take you places, to drive you to the supermarket, to go here with you. People are busy. They're not going to be available to do that. They're not going to want to stop their life to constantly help you. Help yourself. Put your drops in your eye. Any more questions?
It's not pop.
Can you tell us like the difference between the different types of glaucoma? Which one's more serious? Which one's like?
Okay. So that's a good question. There are different types of glaucoma. There's traumatic glaucoma. That's probably the worst one. There is congenital glaucoma. That one too is pretty bad. And then there is more like a genetic type of glaucoma. Traumatic glaucoma, basically as the name implies, you got hurt. Boys, especially when you guys are younger, you like to punch people. I don't know why. You punch each other in the eye. You have little BB guns that you punch people, you shoot at people. That is a very traumatic type of glaucoma. The part of the eye that controls the pressure, that part is broken. We cannot fix it. And so the pressure is out of control. Out of control. Because of the type of trauma, again, usually it's due to punches and gunshots and things like that, it can create a bigger problem. Congenital, usually when the child is born within months, they'll know and they'll start treatment. And then the most serious one, because that one goes undetected for decades, is the one that we kind of get from our family. You're in your 20s, you have glaucoma, you don't know. You're 30, you have glaucoma, you don't know. You're 40, and you're thinking, I can't see. No, you've had glaucoma for 30 years. That's why you can't see. That one is more dangerous because you just don't know about it.
So lastly, I know there's some medications that can decrease the intraocular pressure.
Yes.
So what advice can you give a patient if they have glaucoma and they're taking medication for their glaucoma? What medication should they stay away from to prevent the decrease of the intraocular pressure?
One of the most common ones is steroid. Steroid is great. Steroid is awesome. Steroid is evil. Steroid is bad. Steroid will increase your pressure. I can't say no to steroid. Certain people who, let's take for example, a person that has asthma, severe asthma, and they're on prednisone or the inhalers, those are steroids. And they're on that inhaler since they were 6. Now this person is 45, they're 50. They've been taking steroids all their life. They most likely will have glaucoma. Steroid is a cause of glaucoma. Other medications, there's a lot of them. I'm asking anyone, if you're on a certain medication, if you have a health concern, a health issue, and your doctor puts you on a medication, you're at high risk for glaucoma, you need to ask your doctor, does this medication increase ocular pressure? If it does, is there another option for me? I have 3 family members that have glaucoma. In this country, we're always trying to treat the worst evil, if you understand what I'm talking about. While you're treating A, you're causing B. You gotta pick your battles, you know? But steroid is the main one that will increase your ocular pressure.
Ok, merci Dr. Aznor pour tout le temps ça on fait expliquer nous de santé genou. Donc à part remercier et pour tout le monde qui là nous apprendre, nous avons plus d'informations que nous pour nous faire suivre.